Hi, doctor. My name is Alma Maisara BT SAMJOHAN, and I will be presenting about the basal cell carcinoma. Basal cell carcinoma is one of the types of skin cancer that begins in the basal cells. These cells are located within the skin that makes new skin cells, as old ones die off through the process of apoptosis. It is often thought that this condition occurs because of long-term exposure to the ultraviolet radiation from the sunlight. It takes place on spots that are easily exposed, like the neck, the face. So this is the anatomical structure and physiological functions of the organ. As you can see here, these are the epidermis layers. There are stratum corneum, stratum granulosum, stratum spinosum, lucidum, and basal. These are the dermis layers. There's hypodermis, nerves, muscle receptor, extracellular matrix, immune cells with gland, hair follicle, blood capillaries, fibroblasts, collagen fibers, sebaceous gland, Langerhans cell, Merkel cells, keratinocytes, melanocytes, and hair shaft. There are many functions of the skin. Some of them are it acts as protective barrier against different substances like hazardous substances that can cause harm to the skin and also the inside of the body. Other than that, it also performs sensors for touches and temperature detection. It also helps regulate temperature. This is when here the sweat gland produces sweat so that it regulates the temperature between the environment and also the inside of our body. This is how basal cell carcinoma looks like, and this is the organ of the skin. There are many symptoms of the disease, such as a shiny skin-colored foam that is translucent. It can be seen as brown or glossy black. Other than that, it is a flat, scaly patch with a raised edge, and it can grow larger over time. A white, wavy scar-like lesion, which looks like this. Diagnostics of the disease. The diagnosis of the skin involves a skin biopsy. This requires removing a small piece of the skin or the sample of a lesion for a test in a laboratory. So this indicates or it determines whether you have skin cancer cells in the skin layer. Dermoscopy is a technique that is non-invasive used for diagnosis. It enables visualization of structures of the epidermis and dermis. In order to avoid basal cell carcinoma formation on the skin, there are some prevention that can be done. You can keep away from tanning beds because it produces UV light, which contributes to the formation of the basal cell carcinoma or the cancer cells. Other than that, it is advisable to apply on the sunscreen on skin surfaces that are exposed to UV light. Wear clothing that protects the skin from the UV light, such as long sleeves or long pants. Treatments through surgery, radiation therapy, photodynamic therapy, chemotherapy, or topical treatments. For the prevalence of the disease, it is confirmed that data obtained from the dermatology clinic in Hospital Kuala Lumpur from 2006-2014 conveyed that basal cell carcinoma is the most common type of skin cancer in Malaysia, accounting for 34.9% of the cases. These are the references, and that is all from me. Thank you, doctor.